Hi, and thanks to everyone who's able to join us today. My name is Kim van der Weijde. I'm a project manager at Transaid. Transaid is an international development organization that transforms lives through safe, available, and sustainable transport. And I'm excited to speak to you today about the use of bicycles in health, connecting rural communities to essential health services. So at Transaid, we have really seen how the use of bicycles in rural areas has the potential to greatly impact rural communities, especially in health, education, and livelihoods. And bicycles continue to be, if not increasingly, are considered to be essential to not only increasing rural mobility, but also to lead to improved health outcomes for women and children by providing a vital link to health services and health commodities. So there's two projects in particular I'd like to share with you today, both utilizing bicycles in different ways, but at the same time providing that essential link to health services and commodities. So in Madagascar, as part of a greater Mahefa and later Mahefa Miaraka program, which was funded by USAID and led by JSI, enterprise boxes, or Eboxes as we call them, introduced income-generating activities for community health volunteers that aim to improve rural transport capabilities, CHV motivation, and emergency transport system support. So the model, which was inspired by the Bicycling Empowerment Network in Namibia, relies on quality second-hand bicycles being shipped by international partners to Eboxes, which are then set up in rural communities. And then community volunteers, especially community health workers, volunteer and are trained to work in the Ebox as one of the essential roles, such as a shopkeeper, repair technician, or as part of a management team. Then the returns that are made by the sales and repair of these bicycles are used to fund the operations of the Ebox and as well to support its members. If established in the community, the Ebox also works together with the local emergency transport system to maintain and repair any bicycle-based forms of transport, such as a bicycle ambulance. And then with every container of bicycles that's shipped to these Eboxes, a number of bicycles, normally around 5, are given to recognized community health workers to support their volunteer activities. So now, 7 years after the introduction of the first Ebox, 4 Eboxes are currently independently operating, and they have resulted in some really impressive impacts. So you can see here that in total, the Eboxes have received over 6,500 bicycles, and they've consistently sold almost their entire stock. And then if we look just at the bottom row there, investable funds, this shows the amount of funds that were able to be reinvested into the Ebox or distributed to its members. And now looking back at the end of the program, there have been some really impressive outcomes observed. So I'll outline just a few of them for you. But mostly, so if we look at just the community health volunteers, their participation at the Ebox has led to increased motivation during carrying out their activities, and also their personal development of skills, financial management, Ebox management, sales. And then for those community health volunteers who've received a bicycle donation, they have shown an increased ability to reach families, increased ability to restock their supplies, increased community sensitization. So that's really impacted their ability to carry out their work. And then if we look at the impact that this has had on communities, they have seen improved access to quality and affordable bicycles, which they didn't have before, improved mobility, and also an improved capacity to maintain emergency transport systems where they have them, such as these bicycle ambulances. So the Ebox model has really proven to be a success in Madagascar. However, we would like to share a few key learnings that have been learned along the way. Eboxes should be introduced in areas where there is an established bicycle culture, or at least where there's a strong interest in bicycling, but where quality and affordable bicycles might not be readily available. And local markets should not be infringed upon if they are capable of supplying their own markets. And then there should also be a very strong understanding of the import and transport process amongst the Ebox staff and the board of directors. This is generally introduced during the training of the Eboxes, but should be continuously supported and also supported through the introduction of supplementary materials like training guides and a strong support network. And like anywhere, there will be staff turnover, so refresher training should be readily available, and especially in the form of peer-to-peer training, we've noticed that this is really essential. And then the provision of tools for communication, for example, with international suppliers, is also necessary, as these volunteers generally don't have access to that equipment. And during our work with the Eboxes, we really encouraged them to explore supplementary activities that help support their financial stability as well. And we feel all of these things really contribute to the success of the Eboxes. So then I'll also take you through one of our projects in Zambia. So in Zambia, rural communities face really similar challenges to those in Madagascar. Access to healthcare is delayed by a lack of accessibility to transport, challenging terrain, long distances, and communities are also often unaware of health danger signs and when they exactly need to travel to a health facility. And so here in this project, the introduction of a bicycle ambulance as a community-based emergency transport has been really essential in overcoming these challenges in 5 communities. And this project currently covers a population of over 320,000 people. And a combination of community health volunteers and riders are trained to sensitize their community about health and create awareness around the availability and the advantages of using bicycle ambulances, mostly for pregnant women with danger signs and also for children under 5 who display signs of severe malaria. And for this latter activity, an interventional pre-referral treatment is also made accessible to communities who can then refer their patients for severe malaria to health facilities and complete that with the use of bicycle ambulances. So this systematic approach mobilizes communities and enables them to better integrate themselves into the health system. And the introduction of the bicycle ambulances strengthens linkages between the communities and the health facilities, which has led to improved case management, and the local district capacity is also increased. These bicycle ambulances are really highly valued by their communities, and so far, well over 4,000 children have been transported since 2017. And we have seen in the districts where we have community mobilization, as well as the rectal artisanate and the emergency transport system, that these have shown to have better health outcomes than the districts without the emergency transport system. So over the course of the project, we've seen severe malaria case fatalities fall by 71%, and an increased number of referrals are being made and completed. And as well, women in the community feel more empowered to make decisions related to healthcare, and the riders who ride on the bicycle ambulances in the community are also feeling very empowered by their critical role in saving lives. So that brings me to, I'd like to share you the story of one particular rider. So his name is Emmanuel. You can see him here on the picture. And Emmanuel was recently trained to be a rider, and he shared the impact that the bicycle ambulances had on him and his community with us. And he said that in his community, for children with severe malaria, transport can be really a life or death issue. He said that for those who lack money and transport, they often came to the clinic very late, and that if they reached the clinic late, they sometimes lost the life of a child or a mother. And in Kawaka, that had happened. They lost a child. And so when he heard about ETS, he felt happy that there was some form of easily accessible transport for those who lack money. And he really greatly said transport and healthcare, they should move together. So when you're not using transport, it means, in his own words, you're causing deaths because people come to the clinic very late. But when you're using fast transport, people can be helped. And when the only other option is walking in a lot of these areas, bicycle ambulances can really make a huge difference in cutting down on transportation times. So reflecting back, both of these models, the Madagascar and the Zambian model, integrate bicycles into community infrastructure to support sustainable healthcare. And while both of these models have produced great outcomes, we would like to note that they do require significant effort to scale and are reliant on investment from outside the intervention sites and communities. So in order to build sustainable practices, investment in training and regular support is really needed until these skills are mastered, and then the community systems are fully integrated and can support themselves. But I do hope that this gives you a great and exciting idea about what potential bicycle use has, and we look forward to receiving any questions you might have. Thanks.